So the exceptionality we did our assignment on was Williams syndrome. It's a rare genetic disorder that affects many parts of the body, and it's caused due to the deletion of some genetic material from chromosome number 7, which causes intellectual disability, cardiovascular problems, and distinctive facial features.
So people with Williams syndrome have strength in a short-term memory and face perception, but struggle with number development, spatial cognition, and language development. This disorder also poses an increased risk associated with anxiety, hyperactivity disorder, and attention deficit.
So some signs and symptoms associated with Williams syndrome are a small chin, widely spaced teeth, upturned nose, uneven eyes, and missing teeth.
A treatment for Williams syndrome depends on the severity of the individual's symptoms. So some of the treatment includes surgery for the heart condition, ortho appliances for malocclusion, counseling, and medication for attention deficit.
After completing this assignment, we have been able to gain insight on how disabilities differ from one another, and how us as dental hygienists can modify care in order to make it easier and more comfortable for the individual. Being able to be educated on different disabilities will improve us as healthcare providers as to how we can provide care for our clients and provide them with a positive experience, which will then increase their likelihood of returning for regular dental visits.
So some modification that can be made in the dental office for people who have Williams syndrome are to just check vitals at each appointment due to their heart condition if they have any, and asking the client if they can handle being in a supine position, taking regular breaks, and making sure they feel comfortable with where they are and what procedure will be done.
So people with Williams syndrome often have a higher risk of developing dental caries and periodontal disease due to the intellectual disability that is associated with it. So education at each appointment is very important for them to be able to maintain optimal oral health and understand the benefits and risks of doing it or not doing at-home dental care. And since people with Williams syndrome do have intellectual disabilities most times, modifying or simplifying oral education may be needed in order for them to understand the information being taught. Often, people with intellectual disabilities have trouble understanding concepts and would rather have visual aids used. So being able to utilize their tactile senses is most effective.
So overall, people with and without disability are all the same, and each client should be treated with respect and care regardless of their mental and